It's now my absolute delight to bring to the settee, as we described earlier, we've had the Rural Nurses Forum, and Deb Bailey, who's a rural nurse in Kaikoura, and Sharon Hansen, our first ever rural nurse practitioner, now working in Temuka. And you've been involved with the nurses forums, and Joe just introduced it before. Now we've only got about 10 minutes to summarise what I suspect is many hours of fascinating presentations. So how has it gone, and what have been the highlights for you? And in particular, if I hadn't attended the conference and wanted to know, what did I miss? What did we miss?
I think
the Nursing Council being here.
Yeah.
That was a really important thing that's happened this year that we haven't had in the past. And just building that relationship between the Nursing Council and thinking about what it is rural nurses need and how we function in rural.
And I think that it was probably the first time, you know, that they came to our party, and to hear some of the issues that we face as rural nurses in terms, and so they presented two of their newest documents, which is the Professional Code of Conduct as well as the Professional Boundaries. They're both two documents that they've recently come out with. And so we were able, and as we all recognize in rural, those boundaries and issues, those lines sometimes get a bit blurry, and but we all are passionate about what we do and want to provide the best care that we can.
And there you are. We talked about it before. The nursing in the rural sector is the backbone, really. We sort of we lean on you hugely. So with the Nursing Council coming, we do, and I think we need to say that. Thank you.
Yeah.
So you said that's the first thing you said, the Nursing Council coming. So which way was it? A two-way street, or did you get off your chest as the Nursing Council what you wanted to say, or did they impart what you wanted to hear?
Well, I think that they need a greater understanding of what it is to be a rural nurse and how boundaries
So what did you manage to say?
rural.
What did you get off your chest to them?
Well, they talked about the Code of Conduct specifically, and they talked about boundaries within the Code of Conduct, which we understand from a different point of view in rural. For example, that they used an example of buying a car off a patient. And as some of the nurses pointed out, you couldn't not buy a car off the patient in some of our rural communities because there's nobody else living in those communities who could sell you a car. And going to the supermarket, as we all know in rural, it can be a fraught experience going to the supermarket. And I don't think they really understood that part of our practice and that part of our lives and that intermeshing that goes on.
Well, well done for getting that point across. That's fantastic. And I'm pleased after, what, 23 Rural GP Network conferences, we finally got there. That's fantastic.
Yeah.
So
And they
well
were
done.
very keen to attend, very obliging. So it was just putting the offer out there, really, that has started the dialogue. And I dare say there'll be more.
Excellent,
Yeah,
excellent.
yeah.
So where to from here for that concept, do you think?
Well, it's more about dialogue, isn't it?
Yeah, well, I did suggest that as a group to someone upstairs earlier that maybe we get together and put together a little bit of a dialogue from our perspective, and then possibly submit that. The other thing that came up was the nurse prescribing documents that they've put out there as well. So again, that's just a conversation around potential registered nurses prescribing based on the pilot that they've been doing with the diabetes nurse prescribing. Anyways,
Yeah, they didn't have enough time to really look at that in detail, which was unfortunate, because we did spend some time with some of our other people talking about their research that Jean Ross and Tonia Kemp from Waimate had done.
Very good. Now, you did mention Jean Ross, and she was Skyped in, I
Yes,
believe.
she
Though,
was.
That's the theme of this conference, isn't it? They're getting connected, so she did that in style.
Yeah,
and
she did,
what message did she have to give to you?
Yeah. I think she was looking at how we perceive ourselves within the communities that we work and the work that we do. So there were some key terms.
Yes, she did. She talked about connectedness, knowing and being known in rural communities. And again, those same themes came out through everybody who spoke at that conference. We all had the same things to say, perhaps from a slightly different angle, but everybody was talking about the lack of anonymity, the being connected within the community, and the work that we do within that.
That's very good. Now, unfortunately, we've got to have Joe off the stage in a very short while. But Joe, have you got any thoughts on what we've talked about with nurses seriously relying on them hugely for keeping us afloat?
The general practice teams are necessary in communities, and general practice teams involve people from a whole range of professions all working together, and nurses are, as you said, the absolute backbone of that. People couldn't access good quality healthcare without access to good quality nursing. It's something I think we really need to focus on the nursing workforce, nursing training over the coming years, because it's seen by the government as being a major resource. And there's a sense that nurses are, in general, perhaps not working at the peak of their scope. I think that we might sort of discuss whether they are or they're not really. But there's a challenge there, and there certainly is lots of potential for a greater level of service delivery, I think, from general practice teams as a whole. The doctors need to work at the peak of their scope. Pharmacists need to work at the peak of their scope. We all need to step up. There's an oncoming onslaught of chronic disease and population in rural communities that's going to need to be helped.
Brilliant. Well, thank you very much. Joe, I'm sorry you've got to leave us. I know you've got a busy schedule, but thank you very much indeed again for coming.
Okay.
And we appreciate that.
Thank
God
you.
bless you. Thank you. So we've had Jean and we've had the Nursing Council. What other highlights from the nursing perspective have you got from this?
The dialogue.
Yes.
The dialogue amongst us, because we don't get that opportunity here, and this conference allows us to sit and actually talk about the issues and look at how we can change into the future.
That is awesome. And you feel that's maturing with this conference probably more than any other?
Yeah, this is the second year we've offered the forum.
Yes.
Yeah.
So prior to that, you didn't have that time set aside for nurses to, you could do it over a coffee or a drink or whatever, but to all of it, and if anything, it's now just be building up those numbers.
Right.
So
and showing leadership within that, and enabling nurses to talk about the things that are barriers within, enabling them to work at the top of their scope, and doing something about that, feeding that back to our regulatory body, so that we can now look at what impedes us and how we might overcome some of those barriers.
That's a fair point. And we were talking about this before, but certainly the devolution of work in effect from the secondary to the primary sector, and the need for an expanded workforce. And as Joe pointed out, and with RANDS, hopefully we can coordinate that. But as I said before, the nursing is a huge part of that. Do you think you're ready for that, volume-wise and training-wise and everything else?
I think there's some infrastructure that needs to be put in place, particularly some of the rural issues that we have in terms of having relief cover so that we can attend education sessions, enabling time and energy in people's busy lives to be able to do some of that, having the ability to have education pitched at the level that we're at. So we've got we've got registered nurses, we've got rural nurse specialists, and we've got nurse practitioners, and each group has a slightly different need for a different level of education and input. And so we need to think about how we do that in rural and how we keep connected. For example, peer review. How do you do peer review in rural? How do you talk to other people who just know what your issues are and what you're dealing with? And that's very different in an urban environment to what it is in a rural environment.
That's beautifully put. So we've only unfortunately just got a couple more minutes left. I did this with Chai Chua, and I'm going to do this to you now as well. I want you to imagine I'm a fairy godmother, which is very easily to do. And you've each got one wish. So who wants to have the first wish? So you cast a wish for
a wish
for nursing. Yes, I take your point. Yeah. For nursing and rural health, I had to be specific on that one. You're very right.
Yeah. Probably to have those tiers of nurses recognize and have that education and that support, infiltrated into what we do, so that you're not feeling quite so out there on a limb sometimes, and that communication and that dialogue could be stronger.
So that's a realistic wish, Jen.
Yeah, yeah, I know it is.
Yes, good on you, well done. You can have an unrealistic wish if you like. So Sharon, what would your wish be?
Mine's very similar, and mine's around integration. Mine's around integration in practice between our medical colleagues, our pharmacological colleagues, our physiotherapists, our OTs, our housing court colleagues, the whole lot. I want to see integration, I want to see holism, and I want to see an education system that recognises and supports that. And I want the mana that my work deserves to have within rural practice. I'm not invisible, I don't want to be invisible, and I want to stand up and claim what is ours, how we work with our rural communities.
That's wonderful. Now, I asked Joe this question as well, but so is the world of rural nursing in good heart, do you think?
In good heart. Of course it is. Look at us.
Perfect answer. It's obviously good heart. You just didn't know how to magnify that, did you?
Yeah.
That is wonderful.
Yeah.
Well, I really appreciate you coming.
Yeah,
I appreciate you
thanks,
just being here.
Good work.
And I appreciate the hard work you're doing. And as Joe said, you're not invisible. And I think the Royal General Practitioner and Practice Network hugely values being on board. And I'm thrilled that you're covering the ground you're covering. That's awesome. So thank you very much indeed.